Your mouth could be developing gum disease right now, and you might not even realize it. Take a look at these two sets of gums. The healthy ones are pink and firm, while these inflamed ones are red, swollen, and bleeding. This is what happens when bacteria multiply unchecked beneath your gum line, creating pockets of infection that can quietly destroy the foundation of your teeth. The worst part is that early gum disease rarely hurts, so most people ignore the warning signs until it costs them thousands in dental bills, or worse, they start losing teeth. In just 3 minutes, I'll reveal the specific toothbrush angle that most people completely miss. But first, let me show you exactly what neglect does to your mouth, and more importantly, how to reverse it starting today. Welcome back to Mind Body Balance 459, where we explore practical ways to optimize your health naturally. I'm your host, and today we're diving deep into oral hygiene, because proper mouth care delivers benefits that extend far beyond fresh breath. We're talking about preventing painful cavities, reducing your dental bills, and protecting your overall health in ways you might not expect. Before we continue, please remember, this content is for educational purposes only and should never replace professional medical advice. Always consult your dentist or healthcare provider for personalized treatment recommendations. So why does oral hygiene matter so much? It all starts with a sticky film called plaque that forms on your teeth within hours of eating. This biofilm contains millions of bacteria that feed on sugars and starches from your food-producing acid as waste. When this acid sits against your tooth enamel, it begins dissolving the mineral structure, creating tiny holes that eventually become cavities. But here's what most people don't realize: the frequency of sugar and acid exposure matters more than the total amount. Sipping a sugary drink for an hour creates far more damage than drinking it quickly, because your mouth stays acidic longer, giving bacteria more time to attack your teeth. If plaque isn't removed, it hardens into tartar within 72 hours, and once tartar forms, only a dental professional can remove it. This rough surface provides an ideal breeding ground for more bacteria, leading to inflammation of your gums called gingivitis. Left untreated, gingivitis progresses to periodontitis, where infection spreads below the gum line, destroying the tissues and bones that hold your teeth in place. Your gums begin pulling away from your teeth, creating deeper pockets where bacteria thrive, leading to tooth mobility and eventual tooth loss. The connection between oral health and overall wellness runs deeper than you might expect. Research has established links between gum disease and cardiovascular problems, diabetes complications, and pregnancy risks. While we can't claim that poor oral hygiene directly causes these conditions, the inflammatory burden from chronic gum infection appears to contribute to systemic health challenges. This is why maintaining healthy gums isn't just about your smile, it's about supporting your entire body's well-being. Now let's examine what happens when oral care goes wrong. Gingivitis. The earliest stage of gum disease shows up as red, swollen gums that bleed easily when you brush or floss. You might notice your gums looking puffy or feeling tender to touch. As bacteria multiply, they release toxins that irritate your gum tissue, causing this inflammatory response. The good news is gingivitis is completely reversible with proper care, but ignore it, and the damage becomes permanent. Tartar buildup appears as hard yellowish deposits along your gum line, especially on the inside of your lower front teeth and outside of your upper back molars. These crusty formations not only look unsightly, but they harbor bacteria that continuously irritate your gums. You can't brush or floss tartar away, which is why regular professional cleanings become essential once it forms. Tooth decay progresses through predictable stages, starting with white spots where minerals have begun leaching from your enamel. These early cavities can actually remineralize with proper fluoride use and dietary changes. However, once decay breaks through the enamel surface, creating a visible hole, the damage requires professional restoration. Advanced decay reaches the inner pulp of your tooth, causing intense pain and potentially requiring root canal treatment or extraction. Gum recession exposes your tooth roots, creating sensitivity to hot, cold, and sweet foods. Unlike enamel, the exposed root surface has no protective coating, making it vulnerable to rapid decay. Recession also creates an aged appearance as your teeth appear longer and gaps develop between them. Bad breath or halitosis stems from several sources, but the most common culprit is bacterial overgrowth in your mouth. Bacteria break down food particles and dead cells, producing sulfur compounds that create that unmistakable rotten egg smell. Your tongue's rough surface traps bacteria and debris, making tongue cleaning essential for fresh breath. Dry mouth conditions worsen halitosis because saliva normally helps wash away bacteria and neutralize acids. Here's exactly how to fix these problems with a comprehensive daily routine that takes less than 10 minutes. Start with proper brushing technique using a soft bristled toothbrush held at a 45-degree angle to your gum line. This angle allows the bristles to gently sweep bacteria from the gum pocket rather than just sliding over the tooth surface. Use gentle circular motions rather than aggressive back and forth scrubbing, which can actually damage your gums and enamel. Brush for 2 full minutes twice daily, covering all surfaces of every tooth. Electric toothbrushes often provide superior plaque removal, especially for people with limited dexterity, but manual brushes work perfectly when used correctly. The key is avoiding excessive pressure, which many people apply thinking harder. Brushing cleans better. Your toothbrush bristles should barely bend against your teeth and gums. Interdental cleaning removes plaque from the 35% of tooth surfaces your toothbrush can't reach. Traditional floss works well for tight contacts between teeth, but interdental brushes often prove more effective for larger spaces and around dental work. Choose the right size brush that slides between your teeth with slight resistance, but doesn't force through painfully. Some areas might need floss, while others work better with brushes, so don't feel locked into one method. Tongue cleaning eliminates the bacteria that cause most cases of bad breath. Use a tongue scraper or the back of your toothbrush to gently clean from back to front, removing the white or yellow coating where bacteria accumulate. This simple step often provides immediate improvement in breath freshness. After brushing with fluoride toothpaste, spit out the excess, but avoid rinsing immediately. This allows the fluoride to continue strengthening your enamel for maximum benefit. If you use mouthwash, choose an alcohol-free formula and use it at a different time than brushing to avoid washing away the protective fluoride coating. Your diet plays a crucial role in oral health beyond just avoiding sugar. The timing and frequency of acidic foods and drinks matter more than occasional indulgences. If you drink coffee soda or citrus juices, try consuming them quickly rather than sipping slowly, and rinse with water afterward to neutralize acids. Chewing sugar-free gum containing xylitol after meals stimulates saliva production, which helps buffer acids and remineralize teeth. Staying hydrated supports healthy saliva flow, which serves as your mouth's natural defense system. Saliva washes away food particles, dilutes acids, and provides minerals that strengthen tooth enamel. Many medications cause dry mouth, so discuss this side effect with your healthcare provider if you notice persistent mouth dryness. Lifestyle factors significantly impact your oral health. Smoking and vaping introduce harmful chemicals that impair gum healing and increase infection risk. Teeth grinding often occurs during sleep, causing excessive wear and jaw pain. If you wake up with headaches or notice worn tooth edges, ask your dentist about a night guard to protect your teeth. Schedule dental visits based on your individual risk factors. People with healthy gums and low cavity rates might need cleanings every 6 months, while those with gum disease or multiple risk factors benefit from more frequent visits. Professional cleanings remove tartar buildup that home care can't address and allow early detection of problems when they're easier and less expensive to treat. Now let's rapid fire through the biggest mistakes that sabotage oral hygiene efforts. Brushing too hard damages gums and wears away enamel, so use gentle pressure and let the bristles do the work. Holding your toothbrush flat against your teeth misses the crucial gum line area where plaque accumulates. Replace your toothbrush every 3 months or when bristles fray, because worn bristles lose their cleaning effectiveness. Avoid brushing immediately after consuming acidic foods or drinks, because your softened enamel becomes vulnerable to abrasion. Wait at least 30 minutes for your saliva to neutralize the acid and reharden your teeth. Over-whitening with harsh products or DIY remedies like lemon juice and baking soda can permanently damage your enamel, so stick to dentist-recommended whitening methods. Skipping your back molars during brushing leaves food particles and bacteria in hard-to-reach areas where cavities commonly develop. These teeth do most of your chewing work, so they need extra attention despite being difficult to access. The transformation starts with your very next brushing session. Implement the 45-degree angle technique and gentle circular motions to immediately improve your plaque removal. Add tongue cleaning to eliminate bad breath causing bacteria, and you'll notice fresher breath within days. Consistent daily care prevents the pain and expense of dental problems while supporting your overall health in remarkable ways. Your mouth is the gateway to your body, and caring for it properly pays dividends far beyond a beautiful smile. Small daily investments in oral hygiene compound into major long-term benefits, including confident social interactions, comfortable eating, and significantly lower dental bills throughout your life. What's your biggest oral hygiene challenge, and how will you address it starting today? Share your thoughts in the comments below, and if this video helped you understand the importance of proper oral care, please give it a thumbs up and subscribe for more evidence-based health content. Next week, we'll dive deeper into choosing the right interdental cleaning tools and debunk common mouthwash myths that might be sabotaging your oral health routine. Until then, keep taking care of your mouth, and your mouth will take care of you. Thank you for watching Mind Body Balance 459.